If you are over the age of 60 and you're taking magnesium, or you've tried it and given up because it didn't work, I need you to watch this entire video. Because the mistake I'm about to show you is not your fault. Your doctor doesn't know about it. The label on your supplement bottle hides it. And it is the single reason why millions of seniors are still suffering from broken sleep, leg cramps, anxiety, and racing hearts, even while doing everything they were told to do. And here's the thing. The fix isn't complicated, but it does require understanding something that's been misrepresented for decades. So stay with me, because by the end of this video, you'll know exactly what to take, how much to take, and when to expect results. And I promise you, this is not what you've heard before. I want to tell you about a woman I'll call Margaret. She's 68 years old, retired teacher.
Sharp, active, takes care of herself. And for 3 years, she woke up every single night between 3 and 4 in the morning, heart pounding, legs cramping, mind racing. She told me it felt like her body had forgotten how to sleep, like something had flipped a switch she couldn't find. She'd seen her cardiologist. Her heart was fine. She'd seen her GP. Everything looked normal. She tried melatonin. She tried chamomile. She tried going to bed earlier. Nothing worked. Her doctor eventually suggested a low-dose sleep medication. She didn't want to take it. Her instinct told her this wasn't a sleeping pill problem. And she was right. When Margaret came to me, we didn't start with labs. We started with her medications. She was on a common blood pressure diuretic, a water pill, and a proton pump inhibitor for acid reflux. 2 medications that are extremely common in people over 60. And both of them, silently, steadily, drain magnesium from the body every single day. We changed 2 things. We switched her form of magnesium, and we increased her dose significantly. In 3 days, Margaret slept through the night for the first time in years. She called me and said, "I thought this was just what getting older felt like." It's not. And this video is for every Margaret watching right now. Pick up any magnesium supplement in any pharmacy in this country. Flip it over. You'll see a recommended dose somewhere between 300 and 420 milligrams per day. And most people, reasonably, assume that this number means something meaningful for their health. It doesn't. Not for you. Here's what the label never tells you. That number, the RDA, or Recommended Dietary Allowance, was not calculated to make you feel better. It was not designed to fix your sleep, calm your nervous system, or stop your muscle cramps. It was calculated to be the bare minimum amount to prevent a serious deficiency disease in a healthy person. The RDA definition reads, the average daily level of intake sufficient to meet the nutrient requirements of nearly all healthy individuals. Notice that word, healthy. The RDA was designed for people who are already healthy. If you have high blood pressure, disrupted sleep, muscle cramps, or heart palpitations, you are not starting from the healthy baseline the RDA was built for. The current RDA for magnesium was established in 1997. It was based on body weight data from that era, and more importantly, seniors have entirely different nutritional needs than the average baseline adult. Research published in the journal Nutrients found that magnesium requirements increase with age due to reduced intestinal absorption and increased urinary excretion. Seniors may need 25 to 30% more than standard RDA values just to maintain adequate tissue levels. So when you take 400 milligrams, which already felt like a lot, you may actually be falling short of even the baseline minimum for someone your age, let alone a therapeutic amount. Let's talk about why seniors are disproportionately magnesium deficient and why nobody is connecting the dots for you. There are 4 major reasons your body is burning through magnesium faster than it can be replenished, and most of them are things your doctor prescribed. The first reason is your medications.
The most common medications in the senior population are also some of the most aggressive magnesium depleters in existence. Diuretics, commonly called water pills, flush magnesium through the kidneys every day. Proton pump inhibitors like omeprazole, which millions of seniors take for acid reflux, block magnesium absorption in the gut. A 2018 study found that long-term PPI use caused clinically significant magnesium deficiency in 13% of elderly patients. Metformin, statins, digoxin. Many of the most prescribed drugs in the over 60 population quietly drain magnesium in the background. The second reason is reduced stomach acid. As we age, stomach acid production naturally declines. Magnesium requires an acidic environment to be properly absorbed. Less acid means less magnesium getting in, regardless of how much you take. The third reason is our food. Even if you're eating a clean, whole food diet, and I commend you for that, the magnesium content of our food has dropped dramatically over the past 50 years. Studies comparing produce from the 1950s to today found that magnesium levels in vegetables had dropped by up to 29%. The food looks the same. The magnesium isn't there. The fourth reason is stress and poor sleep. Stress raises cortisol. Cortisol depletes magnesium. Low magnesium worsens sleep. Poor sleep raises cortisol further. Every time you lose sleep, even one night, your magnesium demand goes up the next day. It's a cycle, and most seniors are trapped in it without knowing. Let me explain what is actually happening inside your brain when you wake up at 3 in the morning with your heart pounding and your mind won't stop. Your brain has a gas pedal and a brake. The gas pedal is a neurotransmitter called glutamate. It's the signal that excites your neurons. It fires when you focus, react, problem solve. This is normal and necessary. The brake is a neurotransmitter called GABA. It's the calming signal. It's what allows your neurons to wind down at night so you can fall and stay asleep. Now here's the critical part. Magnesium is the cofactor that allows that off switch to work. It physically sits at a receptor in the neuron and blocks the overactivation of the glutamate response. Without enough magnesium, that block is gone. So at 2 or 3 in the morning, your glutamate system is running hot with nothing to stop it. Your neurons are overexcited, and your brain generates the exact same set of symptoms as a cortisol spike: racing heart, anxious thoughts, an inability to fall back asleep, a feeling of alertness that makes no sense given how exhausted you are. Many seniors, and many doctors, mistake this entirely for a cortisol or anxiety problem and reach for sleep aids. But in a significant portion of cases, the root cause is simply that the brain lacks the raw material to turn itself off. A 2012 review in the Journal of Intensive Care Medicine identified magnesium deficiency as a common and underdiagnosed contributor to neurological hyperexcitability in aging adults, with symptoms frequently misattributed to psychiatric or cardiac causes. Here's how to tell which problem you're dealing with. If you have belly fat accumulation, high morning blood glucose, frequent illness, and elevated blood pressure, that pattern points more toward cortisol. But if your pattern is insomnia despite exhaustion, jaw clenching or grinding your teeth at night, restless legs, muscle twitches, and heart palpitations, that is almost certainly a magnesium-driven glutamate problem. And the good news? You can often feel the difference within 24 hours of correcting it. Two of the biggest health concerns for seniors over 60 are heart health and bone density, and magnesium sits at the center of both, in a way that almost no one is discussing. Let's start with the heart. Your heart is a muscle, and like every muscle in your body, it requires magnesium to contract and relax properly. Magnesium regulates the electrical impulses that control your heart rhythm. When magnesium is low, the heart's electrical system becomes unstable. A landmark study in the American Journal of Clinical Nutrition followed over 3,700 adults for 10 years and found that those with the lowest magnesium intake had a 52% higher risk of dying from cardiovascular disease compared to those with the highest intake. A separate meta-analysis found that magnesium supplementation significantly reduced both systolic and diastolic blood pressure, with stronger effects observed at doses above 600 milligrams per day. If you've been told you have occasional palpitations or a history of atrial fibrillation, low magnesium is one of the first places a cardiologist should look. Many don't. Now for bones. Here's something that surprises most seniors. 60% of the body's total magnesium is stored in the bones. Not in the muscles, not in the blood, in the bone matrix itself. When you're chronically deficient, your bones don't just lose magnesium, they become structurally more brittle. And here's the irony that affects millions of seniors taking calcium supplements. Calcium requires magnesium to be properly metabolized and deposited into bone. Without adequate magnesium, supplemental calcium can actually calcify in soft tissues, arteries, kidneys, and joints, instead of going to your bones. A 2013 study in the European Journal of Epidemiology found that higher magnesium intake was significantly associated with greater bone mineral density in older adults, independent of calcium intake, suggesting magnesium may be a more critical bone health nutrient for aging populations than previously recognized. Even if you solve the dosing problem, even if you take more, if you're taking the wrong form of magnesium, you're flushing most of it down the drain. Literally. The most common form of magnesium sold in pharmacies and big box stores is magnesium oxide. It's popular for one reason: it's cheap and compact. You can fit 400 milligrams into a single small capsule. Convenient and almost entirely useless. Magnesium oxide has an absorption rate of approximately 4%. That means if you take a 400 milligram tablet, your body absorbs roughly 16 milligrams. The remaining 384 milligrams moves through your intestine, pulls water into the bowel, and causes the cramping and loose stools that lead most seniors to stop taking magnesium altogether. So you've already been taking the wrong dose, and now you're taking a form your body can barely use. The deck has been stacked against you from the start. For seniors, magnesium oxide has an additional problem. Because stomach acid is often lower with age, and because many seniors are on acid reducers, the gut environment needed to even partially process magnesium oxide may not be there. Most of the research on magnesium that showed minimal benefit, it was using magnesium oxide. 16 milligrams of actual absorption isn't going to show results in any study. And that's exactly why so many people and so many doctors have concluded that magnesium doesn't work. It's not that magnesium doesn't work. It's that magnesium oxide doesn't work. The form I recommend, specifically for seniors, is magnesium glycinate. Here's why it stands apart. First, it has an absorption rate of approximately 80%. That's not a minor improvement over magnesium oxide. That is a 20-fold difference. You're actually getting what you pay for. Second, it is gentle on the digestive system. Unlike magnesium oxide, magnesium glycinate does not cause diarrhea or cramping at therapeutic doses. For seniors with sensitive guts, this is not a small thing. Third, glycinate, the amino acid it's bound to, has its own calming effect on the nervous system. Glycine is an inhibitory neurotransmitter. It naturally supports GABA activity, which, as you now know, is the brain's off switch. So you're getting a compounded benefit in a single capsule. Here is the step-up protocol that respects the senior body's need for gradual adjustment. Week 1. 200 milligrams of magnesium glycinate at bedtime. Let your body adjust. Week 2. Increase to 200 milligrams in the morning and 200 milligrams at bedtime. 400 milligrams total daily. Weeks 3 and 4. If symptoms persist, increase the evening dose to 300 or 400 milligrams, bringing your total to 500 to 600 milligrams daily. For a therapeutic effect on anxiety, heart palpitations, or blood pressure, clinical studies have used 600 to 800 milligrams daily, divided into 2 doses. A 2017 randomized controlled trial found that participants taking 300 milligrams of magnesium glycinate twice daily for 8 weeks had significantly reduced anxiety and depression scores compared to placebo, with the greatest improvements seen in adults over 60.
A separate meta-analysis found magnesium supplementation led to meaningful reductions in both systolic and diastolic blood pressure in people managing hypertension. Expect early wins on sleep and muscle cramps within 3 to 7 days. Allow 4 to 6 weeks to see meaningful impact on blood pressure, mood, and energy. One important note: if you have kidney disease, do not increase magnesium without talking to your doctor first. The kidneys are responsible for clearing excess magnesium, and this matters. Here's something that will explain why your doctor may have tested your magnesium and told you it was fine, and yet every symptom we've discussed fits you perfectly. Only 1% of your body's total magnesium is in the bloodstream. The rest is in your bones, your muscles, and critically, inside your cells, bound to ATP in your mitochondria. That's where your cells actually use it to produce energy. When your tissues become depleted, your body does something remarkable. It pulls magnesium out of your bones to maintain that 1% in the blood. So your blood test stays normal, right up until the point of severe deficiency. A clinical study published in Nutrition Reviews found that up to 50% of patients who were actually magnesium deficient, confirmed by tissue biopsy, had normal serum magnesium levels on standard blood testing. There is a more accurate test called a red blood cell magnesium test, which looks inside the cells rather than just the plasma. It's better. Ask your doctor for it by name. But even that test misses the mitochondrial magnesium, because red blood cells have no mitochondria. The most practical approach? Look at your symptoms and supplement accordingly. So let's bring it all together. You've been told that 400 milligrams of magnesium is the dose. It isn't. Not for your body, your age, your medications, and your health goals. You may be taking a form, magnesium oxide, that your body barely absorbs, which causes side effects that make you quit before you ever see results. Your blood test probably looks fine, even if you're running significantly depleted in your tissues and your brain. And meanwhile, the symptoms that have been chalked up to just getting older, the broken sleep, the cramping legs, the palpitations, the anxious racing mind at 4 a.m., may have a simple, inexpensive, safe correction. Here's your action plan. Switch to magnesium glycinate, not oxide. Start at 200 milligrams at bedtime and build up slowly over 2 to 4 weeks. Work toward 400 to 600 milligrams daily, divided into 2 doses. Give it 30 days minimum. Commit to the experiment. And tell your doctor what you're doing, especially if you have kidney disease. Margaret slept through the night in 3 days. That's not unusual. When you give the body what it actually needs, at the level it actually needs it, the results can be fast and they can be profound. I'll put a link below to the specific product and dose I typically recommend for seniors, along with references for every study I cited today. As always, your health, your decisions. I'm just here to make sure you have information that's actually worth having. If this helped you, share it with someone over 60 who's been struggling with sleep or heart issues. It might be the most useful video they watch this week. Subscribe so you don't miss what's coming next.